Hello, everybody. This is Tonetta, and welcome back to my channel, Tonetta Clay, and of course, True Sense. Like I said, thank you for coming back and returning for part 2 of the end of life, helping with comfort and care. And I'm going to go ahead and jump right into it, into video number 2. It's called Providing Comfort at the End of Life. And I'll go ahead and start reading for you all. Comfort care is an essential part of medical care at the end of life. It is care that helps or soothes a person who is dying. The goals are to prevent or relieve suffering as much as possible and to improve the quality of life while respecting the dying person's wishes. You are probably reading this because someone close to you is dying. You wonder what will happen. You want to know how to give comfort, what to say, what to do. You might like to know how to make dying easier, how to help ensure a peaceful death, with treatment consistent with the dying person's wishes. And just keep in mind that I know that it keeps saying the dying person's wishes, because I know a lot of times that we, of course, those who are, of course, able-bodied and possibly taking care of a dying person or, of course, going to visit the dying person, we all want to see what we want instead of what the dying person wants. They still, of course, as long as they can still, of course, talk or communicate some kind of way, whether it's through eye blinking or a raise of the finger, they can do that kind of thing. Like I said, it's their choice of how they want to die. No matter whether we want to see them be on the respirator and live as long as they can, all these kind of things, they may not want those machines on their body at all. They may not want that. They may just want to just go ahead and die peacefully and just wither on away, I guess I put it that way, and not have any food or not have any, like I said, the respirator or the ventilators or any of those kind of things. Like I said, it's their choice. If they're wanting a funeral, if they're wanting to have a cremation ceremony, like I said, if they have it written out and they've told you all what they want, please respect their wishes. I know, like I said, we are able-bodied and we want to prolong their life as much as possible and that kind of thing, but we have to realize that it's their choice, it's not our choice. A peaceful death might mean something different to you than someone else. Your sister might want to know when death is near so she can have a few last words with the people she loves and take care of her personal matters. Your husband might want to die quickly and not linger. Perhaps your mother has said she would like to be at home when she dies, while your father wants to be in the hospital where he can receive treatment for his illness until the very end. And like I said, it's their choice, people. It's their choice. Some people want to be surrounded by family and friends. Others want to be alone. Of course, one often doesn't get to choose, and that is the truth. But like I said, if the person has written out their wishes, what they want, as far as the end of life care, please try to respect that as much as possible. But avoiding suffering, having your end of life wishes followed, and being treated with respect while dying are common hopes. Generally speaking, people who are dying need care in 4 areas: physical comfort, mental and emotional needs, spiritual issues, and practical tasks. Their families need support as well. In this section, you'll find a number of ways you can help someone who is dying. Also remember to check with the healthcare team to make sure these suggestions are appropriate for your situation. And like I said in the first part 1, that every situation is different. So comfort needs near the end of life are, again, physical comfort, mental and emotional needs, spiritual issues, and practical tasks. And I'm going to go ahead and get into those right now. Physical comfort. There are ways to make a person who is dying more comfortable. Discomfort can come from a variety of problems. For each, there are things you or your healthcare provider can do depending on the cause. For example, a dying person can be uncomfortable because of pain, breathing issues, skin irritation, digestive problems, temperature sensitivity, and fatigue. Pain. Watching someone you love die is hard enough, but thinking that person is also in pain makes it worse. Not everyone who is dying experiences pain, but there are things you can do to help someone who does. Experts believe that care for someone who is dying should focus on relieving pain without worrying about possible long-term problems of drug abuse or dependence. Don't be afraid of giving as much pain medicine as is prescribed by the doctor. Pain is easier to prevent than to relieve, and severe pain is hard to manage. And I repeat that again. Pain is easier to prevent than relieve, and severe pain is hard to manage. Try to make sure that the level of pain does not get ahead of the pain relieving medications. Like they said, we don't want, and like I've seen myself with my parents, and well, I guess with my mom and with my father-in-law, my ex-father-in-law at the time. Like I said, we don't want to see people who are dying in pain. We want to make sure that they're comfortable as much as possible towards the end of life, and there's all kind of ways that can occur. And like I said, I'll get into that shortly. Tell the doctor or nurse if the pain is not controlled. Medicines can be increased or changed, and it always can, no matter what the doctors and nurses may say. If this doesn't help, then ask for consultation with a palliative medical specialist who has experience in pain management for seriously ill patients. And I'll get more into palliative care once we get farther along in these teachings. And I'm going to go ahead and read this little small section they have. It's talking about, it says, what about morphine or other painkillers? Morphine is an opiate, a strong drug used to treat serious pain. Sometimes morphine is also given to ease the feeling of shortness of breath. And just to keep in mind, morphine is a pain medicine that's given a lot in hospitals and at home to keep the person, like I said, dying comfortable. And like it said, help relieving the ease of shortness of breath, because the breathing will change as closer they get to death and that kind of thing. So just keep those kind of things in mind. And I remember back when my mom was on, when she was in the hospice, and she had the morphine as well. So like I said, just keep that in mind. That is a medicine that can be prescribed for someone who is dying, among other pain medicines. Pain medication can make people confused and drowsy, which it will. You might have heard that giving morphine leads to a quicker death, but is that true? Most experts think this is unlikely, especially if increasing the dose is done carefully. Successfully reducing pain and our concerns about breathing can provide needed comfort to someone who is close to dying. And like I said, it's their choice. Keep in mind that I know we want to relieve the pain, relieve the whatever they're doing. Like I said, sometimes if the person can still talk, they can let us know that they don't want any pain medicines, they don't want any of this, they don't want any of that. And as far as we can do, as far as you can allow legally, please make sure that you're following their wishes. Struggling with severe pain can be draining. It can make it hard for families to be together in a meaningful way, and that's true. Pain can affect mood. Being in pain can make someone seem very angry or short-tempered. Although understandable, irritability resulting from pain might make it hard to talk, hard to share thoughts and feelings. The next one is breathing problems. Shortness of breath, or feeling that the breath is difficult, is a common experience at the end of life, and that's definitely the truth, because I remember my mom and my father-in-law going through that as well. The doctor might call this dyspnea. Worrying about the next breath can make it hard for important conversations or connections. Trying to raise the head of the bed, opening a window, using a humidifier, or having a fan circulating in the room may help. Sometimes morphine or other pain medications can help relieve the sense of breathlessness. People very near death might have noisy breathing, sometimes called a death rattle. This is caused by fluids collecting in the throat, or by the throat muscles relaxing. And I heard that with my mom as well. I just didn't know what it was back then, but now I know what it is. And it sounds scary, of course, because it's not going to be something that we're of course used to hearing, but that is what occurs. It might also help to try turning the person to rest on one side. There is also medication that can be prescribed that may help clear this up. Not all noisy breathing is a death rattle. It may help to know that this noisy breathing is usually not upsetting to the dying person, even if it is to us family and friends. The next is skin irritation. Skin problems can be very uncomfortable. With age, skin naturally becomes drier and more fragile, so it's important to take extra care with an older person's skin. Gently applying alcohol-free lotion can relieve dry skin and be soothing. Dryness on parts of the face, such as the lips and eyes, can be a common cause of discomfort near death. A lip balm could keep this from getting worse. A damp cloth placed over closed eyes might relieve dryness. If the inside of the mouth seems dry, giving ice chips if the person is conscious, or wiping the insides of the mouth with a damp cloth, cotton ball, or specially treated swab might help. And if you don't have some of those items, especially like with the treated swabs and things like that, the doctors, of course, they can assist you with that. And if you all already have palliative care, hospice care in the household, they can, of course, just give you those items as well. And they're usually for free. So just make sure that you're asking your team what they can provide you with. Sitting or lying in one position puts constant pressure on sensitive skin, which can lead to painful bed sores, sometimes called pressure ulcers. When a bed sore first forms, the skin gets discolored or darker. Watch carefully for these discolored spots, especially on the heels, hips, lower back, and back of the head. Turning the person from side to side and to the other side every few hours may help prevent bed sores. Try putting a foam pad under an area like a heel or elbow to raise it off the bed and to reduce pressure. Also ask if a special mattress or chair cushion might also help. Keeping the skin clean and moisturized is always important. And just keep in mind, if you all do not have the foam pad, I know they use some of those in yoga classes and that kind of thing as well. They're similar to the foam pads that you can use for a person that's lying in the bed on one side to keep their skin intact so they won't get the pressure ulcers. And if you don't have the foam pads or items, you can always use like rolled up towels, rolled up sheets or things like that, comforters, throws, things like that, or just a regular pillow if you have extra pillows around the house as well. The next section is going to be talking about digestive problems. Nausea, vomiting, constipation, and loss of appetite are common issues at the end of life. The causes and treatments for these symptoms are varied, so talk to a doctor or nurse right away. There are medicines that can control nausea or vomiting or relieve constipation, a common side effect of strong pain medications. And with the morphine, like I said, 9 times out of 10, my mom was on a medication to relieve constipation as well, because that is definitely a side effect of that. If someone near death wants to eat but is too tired or weak, you can help with feeding. To address loss of appetite, try gently offering favorite foods in very small amounts, or try serving frequent, smaller meals rather than 3 big ones. You don't have to force a person to eat. Going without food or water is generally not painful, and eating can add discomfort at times. Losing one's appetite is common and a normal part of dying. Swallowing may also be a problem, especially for people with dementia. A conscious decision to give up food can be part of a person's acceptance that death is near. And just keep in mind, I know for us that's very scary. Like I said before, some people are going to tell you if they can tell you, or just refuse the food or turn their head like my mother used to do, that kind of thing. They don't want to eat, and they usually know that death is near. So they don't want to, of course, prolong the process. Even though we want the process prolonged, they don't want to. And like I said, that's their right. And you cannot force them to take the food, to take the water, to take the medicines, or whatever you're trying to give them. So just keep that in mind. Yes, it's very painful for us to see and to go through that. But like I said, that's part of the process. And if that's what they want, we have to respect them enough to give that to them. Temperature sensitivity. People who are dying may not be able to tell you that they are too hot or too cold, so watch for clues. For example, someone who is warm might repeatedly try to remove a blanket. You can take off the blanket and try a cool cloth on his or her head. If a person is hunching his or her shoulders, pulling the cover up, or even shivering, these could be signs of cold. Make sure there is no draft, raise the heat, and add another blanket. Avoid electric blankets because they can get too hot, and you can forget, of course, in my terms, that it's plugged up and it can actually burn them. I guess I put it that way. So you definitely want to make sure that there's nothing electric. Just pile on the blankets as much as you can and make sure the heat is up. Fatigue, that's another symptom. It is common for people nearing the end of life to feel tired and have little or no energy. Keep activities simple. For example, a bedside commode can be used instead of walking to the bathroom. They also have things called urinals for the males with the penises. They have urinals where the penis just goes like inside of like the top of the container, so they can urinate in there. For the women, they do have something similar to a urinal that fits over like the vaginal area, so they can't just urinate into that just in case they cannot get up. or they're too weak to get to the bathroom or to the actual commode, like beside the bed. So let's keep that in mind, that there are simple things that you can buy either at Walmart or CVS, Walgreens, that kind of thing, or just ask your doctor or your team for that's assisting you with this process. A shower stool can save a person's energy, as can switching to sponging off in bed. And like I said, if they're too weak to get up and that kind of thing, just keep in mind you can always give a sponge bath. They do have special cloths that you can, of course, get from your hospice team or your palliative care team if you have hospice palliative care in the home, or if not, ask your doctor's office. They sometimes have like a a dry to wet cloth that you can just apply water and wipe the person down with instead of having to get them up and get them into the shower and they're weak to hold themselves up or that kind of thing. All this stuff can be done in the bed, you all, so you won't disturb them too much. And they also put a story in here, and I'm going to read this story to you at all. And it says it's Mina's story. At age 80, Mina had been in a nursing home for 2 years after a stroke, when her health declined and she was no longer able to communicate her wishes. Mina's physician, Dr. Torres, told her family she was dying. She said that medical tests, physical therapy, and intravenous treatments were no longer really needed and should be stopped because they could be increasing Mina's discomfort. Dr. Torres also said that checking vital signs, pulse, blood pressure, temperature, and breathing rate was interrupting her rest. It would no longer be done regularly. Then Mina developed pneumonia. Her family asked about moving her to a hospital. Dr. Torres explained that Mina could get the same care in the familiar surroundings of her nursing home or at home. Besides, the doctor said, a move could disturb and confuse her. The family agreed to leave Mina in the nursing home, and she died 2 days later, surrounded by those closest to her. Experts suggest that moving someone to a different place, like a hospital, close to the time of death, should be avoided if possible. And like I said, just keep in mind that a lot of the things that they do in hospitals can be done at home or wherever the person is, if they're in a nursing home or family's house, friend's house, wherever they're at. All those kind of things can be done at home, even IVs and things like that as well. If you have a medical team or if you don't have one yet and you need palliative care or hospice care to come in to assist with the dying process, if they've been given 6 months or less to live, remember that hospice has the ability to do all those kind of things. There's nurses on that staff and on that team. There's social workers. There's a doctor, of course, that's on call, all those kind of things, and they can provide IVs and different things in the home, pain medications, all those kind of things to the patient so you wouldn't have to move them, including antibiotics and whatever kind of medical equipment you may need. And just ask them. And don't be afraid to ask. And the next topic is mental and emotional needs. Complete end-of-life care also includes helping the person manage mental and emotional distress. Because, of course, they're going through this process. Of course, it's their body, it's their health, is their failing, that kind of thing. And I'm sure a lot of things are going through their mind as well. Someone who is alert near the end of life might understandably feel depressed or anxious, and that will be. It is important to treat emotional pain and suffering. Encouraging conversations about feelings may also help. You might want to contact a counselor, possibly one familiar with end-of-life issues. If the depression or anxiety is severe, medicines may help. A dying person may also have some specific fears and concerns. He or she may not fear the unknown, or he or she may fear the unknown or worry about those left behind. And keep that in mind. That's going to be the majority of the people I've seen and been through the dying process. That has been every single one of them. So just keep in mind that they can, of course, get depressed. They're feeling, of course, they're leaving all this stuff behind. How is the family going to manage all those kind of things? The best thing that you can do is try to ease their worrying and suffering by, of course, sparking those kind of conversations. Yes, they're very hard conversations, but please do spark them, because you don't want the person, of course, constantly worried, constantly depressed, and constantly anxious and having anxiety attacks and things like that, when it takes a simple conversation to go over these things and to ease their mind. Some people are afraid of being alone at the very end. This feeling can be made worse by the understandable reactions of family and friends and even the medical team. For example, when family and friends do not know how to help and what to say, sometimes they stop visiting, or someone who is already beginning to grieve may withdraw. And keep in mind, I know that it's very hard for us who are here trying to take care and visit with the dying person, but just keep in mind they need all the support that they can get. I can't say this enough. I know we have to put ourselves aside at this time in order to, of course, visit with the person, take care of the person, and be there for that person. Like I said, they're going through this whole process and they may be feeling alone, withdrawn, depressed, anxious, having all these other symptoms going on and pain, these kind of things going on. We have to try to be there as much as we can. I know it's hard. I know it's hard. I was there for my mom like that, constantly going to see her. I was, 19, 20 years old. I had no idea what a hospice was. I know they told me what it was, and I was like, okay, she's going to get better. She's going to get better, and not knowing that this was her end of life. She only had 6 more months to live or less. And like I said, going to see her every day and trying to keep a positive spirit and trying to, of course, make her laugh when she could, of course, laugh, or trying to, of course, spark conversation and see how she's doing, that kind of thing. Yes, it's very hard, but we must do that. You don't want this person to expire and you haven't even told them you love them or had these conversations about how the kids are going to be doing after they're gone and how they're going to, I guess, how you're going to create, I guess, like a photo album for them, that kind of thing. And speaking about photo albums, and it may talk about that in this book as well. But just keep in mind that every person wants to have some kind of legacy when they leave this earth, and creating some kind of, whether it's in video form, picture form, or written words, creating something for the dying person, or I guess if they can assist in the process as well, if they're able, but creating something for the dying person so they can have something to, of course, pass on to the next generation. That is definitely very important. And like I said, keep those kind of things in mind, but just make sure that you're still supporting the people as much as you can. I know it's hard for us. I know we're going to be grieving through the process, crying sometimes, trying to hide our tears when we go into the room. But like I said, just try to be there as much as you can. If you can't be in there, send the kids in, send somebody in that's, of course, cheerful and in a better mood until you can get yourself together. And it also says doctors may feel helpless because they can't cure their patient. Some seem to avoid a dying patient. This can add to a dying person's sense of isolation. If this is happening, discuss your concerns with the family, friends, and or the doctor or the team. The simple act of physical contact, holding the hands, a touch, and a gentle massage can make a person feel connected to those he or she loves. And it's very important to keep that physical contact as well. It can be very soothing. Warm your hands by rubbing them together or running them under warm running water. Try to set a comforting mood. Remember that listening and being present can make a difference. For example, Gordon loved a party, so it was natural for him to want to be around family and friends when he was dying. Ellen always loved spending quiet moments with 1 or 2 people at a time, so she was more comfortable with just a few visitors. Some experts suggest that when death is very near, music at a low volume and soft lighting are soothing. In fact, near the end of life, music therapy might improve mood, help with relaxation, and lessen the pain. Listening to music might also evoke memories those present can share. For some people, keeping distracting noises like television and radios to a minimum is important. And there's all kind of, if you're looking for some soothing music to play, YouTube, Spotify, all those places have like meditation music and yoga music and all that kind of stuff that you can play as well. And there's chimes and there's all kind of things that you can find to play that's instrumental, if you want instrumental. If not, gospel music, of course, is also definitely something you can play as well. Christian music, whatever kind of religious music or music that the person loved. Often just being present with the dying person is enough. It may not be necessary to fill the time with talking or activity. Your quiet presence can be a simple and profound gift for a dying family member or friend. And here's another one, spiritual issues. People nearing the end of life may have spiritual needs as important as their physical concerns. Spiritual needs include finding meaning in one's life and ending disagreements with others if possible. The dying person might find peace by resolving unsettled issues with family or friends. Visits from social workers or counselors may also help with this process if you need, so definitely keep that in mind. Many people find solace in their faith. Others may struggle with their faith or spiritual beliefs. Praying, talking with someone from one's religious community, such as a minister, priest, rabbi, or imam, reading religious texts like a Bible or the Quran, listening to religious music may bring comfort. Family and friends can talk to the dying person about the importance of their relationship. For example, Adult children can share how their father has influenced the course of their lives and how much he meant to them. Grandchildren can also let their grandfather know how much he's meant to them. Friends can relate how they value years of support and companionship. And remember those trips and all those activities that you all went on. Make it a joyous time. Family and friends who can't be present can send a recording or video of what they would like to say or a letter to be read out loud. Sharing memories. Sharing memories of good times is another way some people find solace near death. This can be comforting for everyone. Some doctors think it is possible that even if the patient is unconscious, he or she might still be able to hear. It is probably never too late to say how you feel or to talk about fond memories. Always talk to, not about, the person who is dying. When you come into a room, it is a good idea to identify yourself, saying something like, "Hi Juan, it's Mary. I've come to see you and check on you." Another good idea is to have someone write down some of the things said at this time by both by and to the person who is dying. In time, these words might serve as a source of comfort and solace to friends. People who are looking for ways to help may welcome the chance to aid the family by writing down what is said. And these words can be written, I guess, like I said, written down, whatever the dying person is saying, any like words of wisdom, seeds that they're planting, that kind of thing, especially if they're still talking. Like I said, you can use all those things to, of course, reflect back on, to, of course, read at the memorial service or at the funeral service, all those kind of things. So just keep that in mind. There may come a time when a dying person has been confused suddenly. Oh, I'm sorry. There may come a time when a dying person who has been confused suddenly seems clear thinking. Take advantage of these moments, but understand that they may be temporarily, not necessarily a sign that he or she is getting better. Sometimes a dying person may appear to see or talk to someone who is not there, and we call that hallucinating. Try to resist the temptation to interrupt or say they're imagining things. Just let them go through their process. Give the dying person the space to experience their own reality, and give them that respect to not interrupt them. Practical tasks. Many practical jobs need to be done at the end of life, both to relieve the person who is dying and to support the caregiver. Caregiving is a very, very hard and strenuous task, and it can be very hard on somebody and stressful on someone. Everyday tasks can be a source of worry for someone who is dying, and they can seem overwhelmed as a caregiver. Taking over small daily chores around the house, such as picking up the mail or the newspaper, writing down phone messages, doing a load of laundry, feeding the family pet, talking or taking children to soccer practice, or picking up medicine from the pharmacy can provide a much needed break for caregivers. And if you're not available to do that, and I guess I'll do a shameless plug, my business is Life Hack, a lifestyle management service. I'm a personal assistant, and of course those are some of the tasks that we all do as well, or I guess that I do as well. And I'm sure in your area there's other personal assistants that could, of course, possibly help. But if you're in the St. Louis area, just look me up. I can definitely assist with that process as well. If you're needing some household tasks to be done for a dying person or a non-dying person. So just keep that in mind, especially if the caregiver or the family is having a hard time keeping those tasks in order and completing those tasks. There's always someone that you can pay to do those things for you and to take that load off. A person who is dying might be worried about who will take care of things when he or she is gone. Offering reassurance, I'll make sure your African violets are watered. Jessica has promised to take care of the bandit. Dad, we want Mom to live with us from now on, might provide a sense of peace. Reminding the dying person that his or her personal affairs are in good hands can also bring comfort. Everyone may be asking, "What can I do for you?" It helps to make a specific offer. Say to the family, "Let me help you with," and suggest something like bringing meals, bringing desserts for the caregivers, paying some bills, buying toiletries, walking the dog, babysitting, whatever you can do to assist them around the household with the caregiver. Because like I said, caregiving is a very strenuous task, and a lot of times the caregivers do burn out and they need help. They may not say that, but they do need help. If you're not sure what to offer, talk to someone who has been through a similar situation and find out what kind of help was useful for them. If you want to help but can't get away from your own home, You could schedule other friends or families to do small jobs or to bring in meals or get you a personal assistant. This can allow the immediate family to give their full attention to the person who is dying. If you are a primary caregiver, ask for help when you need it and accept help when it's offered. I know it's hard that you want to do everything yourself and you may feel guilty if you don't, but like I said, at some point you're going to need to take a rest and take a break so that you can be your best to continue taking care of that dying person. Don't hesitate to suggest a specific task to someone who offers help. Family and friends are probably anxious to do something for you and are the person who is dying, but they may be reluctant to repeatedly offer when you are so busy or you keep saying no. So say yes. Keeping close friends and family informed can feel overwhelming. Setting up an outgoing voicemail message, a blog, an email list, or a private Facebook page, or even a phone tree, or text messages can reduce the number of calls you have to make. Some families create a blog or a website to share the news. This can be done in a video blog, like on YouTube, or to me on a video blog, or private book or private page. On Facebook, they have all the events and that kind of thing you can create. Or you just create your own private group where everybody can check in, say what's going on. You can share pictures of everybody and the person who is dying as well and try to keep that communication going. That's probably the simplest way to use social media since it's free for everybody to use, and hopefully everybody would have that app. Some families create a blog or a website to share the news, thoughts, and wishes. And it says, see to learn more about comfort care. See page 17, which I'll get to that hopefully in a few, for organizations that can make setting up such web pages easy and secure. And just keep in mind there are agencies like myself, or businesses like myself, or agencies as well, who can, of course, create those kind of groups and those kind of social media pages for you. So just reach out to us if you need our assistance. And don't try to do everything yourself if you cannot. We're only a phone call away. Or you can assign a close family member or friend to make the updates for you. These can all help reduce the emotional burden of answering frequent questions, and that it definitely can. Okay, let me see. Questions to ask about providing comfort. Family and friends can provide comfort and ease to someone nearing the end of life. Here are some questions to help you learn more. Ask the doctor in charge, since there is no cure, what will happen next? Because you all want to know what will happen next once the person's, of course, at home, what you're going to be expecting. And it may be different for everybody, but some of the things are the same. The next question, by asking the doctor in charge, why are you suggesting this treatment or test? Will the treatment bring physical comfort? Will this treatment speed up or slow down the dying process? What can we expect to happen in the coming days or weeks or months? Ask the caregiver, the person who is caring for the dying person. How are you doing? Do you need someone to talk with? Would you like to go out for an hour or two? I could stay here for a while you're away. And just keep in mind, they may not say, but just keep in mind that there is a thing called respite care. And if you have a home health care agency providing services for you, I guess along with the hospice care on your team, just keep in mind that they can come in for several hours a day to provide respite care. And respite care is just like a break for you to go out and do some things or just rest, I guess, for the time while somebody else that's a CNA or LPN, that kind of thing, take care of your dying loved one. And like I said, they can offer, it's called respite care. Another thing to ask a caregiver, who has offered help to you? Do you want me to work with them to coordinate our efforts? Can I help? Maybe walk the dog, answer the phone, go to the drugstore or the grocery store to clean up or wash the children, for example, for you. Ask them, can you do those things for them, and be specific. To learn more about comfort care, some of these resources, like I said, a lot of these things may not be in your area. I think they're just like national numbers. But like I said in the last, by part one, all these resources, I'll say a few of them, but like I said, there's a lot of things here locally in St. Louis and in your town, I'm sure, as well, that you can, of course, access. You will have to do a search on Google, which is free, for different comfort care programs that are out there, pain management programs, that kind of thing. But like I said, you can always look up palliative care, hospice care, and they can give you all the information as well. And here in St. Louis, we have the End of Life Coalition, and I have been to a lot of their trainings in the past, about 2 years since I've been working for this home health care agency, and they provide a lot of free resources and workshops for professionals and for the community as well. But let me see, trying to see, they have American Academy of Pain Medicine. They have that as a online website, and it's www.painmed.org. They have the American Music Therapy Association. They have Caring Bridge, at caringbridge.com. And a lot of these places I have never heard of, but definitely, like I said, just search places in your area. Caring Info, they're a national hospice and palliative care organization, and that's www.caringinfo.org. And their 1-800 number is, since it's national, is 1-800-658-8898, and it's toll free. And they have the Hospice and Palliative Nurses Association. Now that I believe is nationwide as well. And that website is www.hpna, and that stands for Hospice and Palliative Nurses Association.org. hpna.org. National Alliance for Caregiving, Post Hope, and What Matters Now. And like I said, those are definitely different resources that you can find, but just keep in mind that you can always use free Google to help you find different resources about palliative care, hospice care, what to ask. You can just search end of life questions, or what to expect to end of life, or you can look at videos like this and share this with your family and communities so they can definitely understand what's going on and how this process may go. But like I said, this is part 2 of the end of life, helping with comfort care, and I hope you all got a lot from this particular video. And I will be back, of course, with number 3. I guess I put it that way as well. But like I said, this part was mainly about providing comfort at the end of life, as far as making sure you're keeping the person comfortable, as far as with physical comfort, making sure their mental and emotional needs are taken care of, making sure their spiritual needs are taken care of, and making sure those practical tasks are taken care of as well, as far as household tasks, managing their pain, breathing issues, anything like that at all. Like I said, this is what this chapter was about. And I hope you all got some information from here that you can share, of course, with your family and friends and those who are going through this process and need some assistance and need some help. Like I said, please feel free to share this video with your families and your tribe. I do not mind. And like I said, if you all want to ask me questions or have any concerns for me or have any questions for me, definitely leave it down in the comments. I do not mind as well. Or if you want to message me privately on Facebook or LinkedIn or Instagram, any of those sites, it's the same name, Tonetta Clay, all across the board, even on Twitter. So like I said, I hope you all enjoyed this video and got a lot of nuggets that you can, of course, apply in your own life when you're dealing with this situation. That's the end of life. And like I said, if you all have any questions or concerns, please do get at me and let me know. Everybody take care, and I'll see you in part number 3. Thank you. Bye-bye.